Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Causes of liposarcoma. There is no known cause of liposarcoma. Researchers have discovered certain risk factors that may increase a person's chances of developing this type of cancer, including genetics and previous exposure to radiation or toxic chemicals. /r/n/r/n This article will review the risk factors associated with liposarcoma and what you can do to reduce your risk. /r/n/r/n Illustration by Jake Shi for Verywell Health/r/n/r/n A risk factor is anything that increases the likelihood of developing a disease. There are no known causes of liposarcoma, but some risk factors have been identified for liposarcoma, including /r/n/r/n Liposarcoma is believed to be triggered by mutations, changes, to genes within fat cells that cause cells to grow uncontrollably. These genetic mutations occur sporadically, at random, or are acquired over a person's lifetime. They are not passed down from a parent. /r/n/r/n There are some inherited genetic conditions that are known to increase a person's predisposition for developing cancer. Some of these conditions can increase the risk of liposarcoma, including /r/n/r/n If you or anyone in your family has one of these conditions, it may be worth having a conversation with your healthcare provider. They can give you information about genetic testing, what you can do to reduce your cancer risk, and how to set up routine screenings to aid in catching any cancer that may develop as early as possible. /r/n/r/n Lifestyle factors, including diet, exercise, and smoking, have not been associated with an increased risk of developing liposarcoma. However, adopting healthy habits such as limiting alcohol, avoiding tobacco products, staying physically fit, and eating well are measures that have shown promise in reducing a person's overall cancer risk. /r/n/r/n There is no definitive cause of liposarcoma. Certain risk factors, including being male, having prior exposure to radiation, such as during treatment for an earlier cancer, occupational exposure to industrial chemicals, particularly vinyl chloride, and having a familial cancer syndrome, may raise your likelihood of developing liposarcoma. /r/n/r/n If you have been diagnosed with liposarcoma, you may be wondering how this happened to you. Know that there is nothing you could have done to avoid this very rare cancer. It was beyond your control, but you are not alone, and you can get through this with a strong support system around you. /r/n/r/n If you know that you have a predisposition to cancer due to a genetic condition, make sure to have a conversation with your healthcare provider regarding your options and how you can lower your risk. Your healthcare provider can help you create a plan and a screening protocol that is right for you. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.